If you were in an accident or suddenly became ill and were brought to an emergency room unable to communicate, would a doctor know your medical history? How about which medications you were taking? That information could save your life, and the doctors need to know it fast.
Health insurance carriers have the most current and probably the most accurate information about a patient. We gather information about hospital visits, physician visits, prescription drugs, laboratory studies. We can get that information to the physician, giving him or her the opportunity to make better informed therapeutic and diagnostic decisions, ultimately resulting in better outcomes and better quality of care.
More complete information means healthcare professionals can make better decisions.
Physicians rarely have all the medical information that exists for a patient. We make incredibly important decisions based on data that isn't nearly as comprehensive as it could be. Filling in the additional blanks with patient information is tremendously advantageous to us and our patients, and ultimately to the entire healthcare system.
The solution to the problem, like most in this age of information, comes down to technology, or more specifically, the exchange of health information. The patient clinical summary is an electronic health record that provides a common view of a patient's medical history by summarizing and clinically validating data from claims, pharmacy, and care management sources and delivering it to users at the point of care. It is created using data that exists within the walls of the patient's health plan.
When I was in practice, patients would see me and they would not have a clear recollection of surgery that they had had, when they had had the surgery, or even recent laboratory tests. As we have that information and we can give it to their physicians, we know that we can improve the quality of care and speed up the resolution of whatever illness or problem the patient has.
Well, the data that physicians have on file is rich in detail, but it is limited to those interactions between each individual doctor and each individual patient. The PCS offers a much broader view of a patient's healthcare-related activity, other doctors they've seen, tests they've had, medications they've taken, what treatment opportunities exist. This is potentially difference-making information in the treatment process and makes the PCS tremendously useful and unique.
The United States healthcare system is being severely constrained by a lack of clear, concise, and complete patient information. The federal government has already called for a shift toward electronic health records for all Americans. Developed by Pennsylvania-based MEDecision, the patient clinical summary delivers critical information to physicians when and where the patient is being treated.
The patient clinical summary has the ability to dramatically improve healthcare delivery. It takes all of the information a health plan knows about a patient, claims information, pharmacy, lab results, and care management data, and creates a clinically validated, summarized electronic health record which is transportable to the point of care. Once doctors and other caregivers have access to this information, their decisions will be more well-informed, more timely, and we believe this will result in reduced medical costs and better healthcare outcomes for patients.
To use the PCS, all you need is an internet connection and printer. There's no software to install or anything like that. For the most part, it's easy to integrate into the daily workflow. Generally, it's pulled during the patient's initial eligibility check, printed and put into their file. The components that I find most useful are the medication list it provides, the medical condition or problem list, the list of hospital admissions and ER visits, and the summary of monitored services.
MEDecision has been in the health information technology industry for nearly 2 decades and has been actively involved in the electronic health information evolution during this time. As a result, MEDecision holds a unique position in the industry that allows them to have an expanded view of the market and to understand that today more people than ever stand to benefit from electronically maintained and shared health information.
Information technology is finally poised to transform healthcare the way that it's been used to transform virtually every other industry. And we believe that the patient clinical summary is one of the most promising ways for it to do so. We've looked at the financial impact of the use of the patient clinical summary by emergency room physicians at a level 1 trauma center here in the Mid-Atlantic. When we looked at the cost of the emergency room visit itself and the cost of the first day of stay for those patients who were admitted through the emergency room, we found an overall savings of about $545 per visit. When one considers the 110 million emergency room visits in this country a year, you can see why people are so excited about the ability of the PCS to improve both the quality of care and the affordability of care.
As the health information technology revolution progresses, MEDecision believes that greater levels of interoperability and connectivity among patients, health plans, and physicians will lead to increased collaboration between the three parties. For more information on how MEDecision's industry-leading products and services can help your business improve and prosper, contact them today.